Good morning, and welcome to this week's episode of the Ask Dr. Murphy series. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator here with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you doing this morning?
Good morning, doing well.
Dr. Murphy is the executive director of the Havey Institute for Global Health, as well as the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your COVID, public health, or infectious disease questions each week here on the Institute's Facebook page. Today, Dr. Murphy will be addressing the latest headlines as well as answering a few submitted questions through today, October 5th. We invite you to submit any questions you have down below in the comments via Facebook at NU Institute for Global Health or via email at globalhealthinstitute@northwestern.edu. Starting with the US COVID statistics for this week, average new hospitalizations per day are 2,728, and average COVID deaths per day are at 86.7. The new booster proportion, which is no longer being given out, stayed steady at 17%. But Dr. Murphy, your reactions to those numbers?
Well, they're up from a month or so ago, but they're not like increasing, hugely. So, maybe we've leveled off. So we need to continue to monitor and see what happens, because we're just roaring into the flu season now, and that could drag in COVID and RSV with it. And the problem is we don't really know how much COVID is out there. In my just clinical experience, there's a lot of COVID out there, but people are handling it. They're taking Paxlovid if they need it. That's the treatment for COVID. And it's not like spreading incredibly fast in like family situations or groups. Like, was at a wedding recently, the bride gets COVID the day before the wedding. The groom never got it. And nobody else at the wedding got it. So it's like, it's just a crazy kind of situation, different than before. It used to be if someone in the family got it, almost everybody in the family got it. So that's great. And that's why the numbers are probably suppressed. But there is a lot of COVID going on.
Lots and lots of COVID. And on that note, there have been notes from medical professionals urging those vaccinations. Can you tell us a little bit about the concern about, why we're getting so many of these announcements?
Yeah, the Infectious Disease Foundation, the Kaiser Family Foundation, and other groups that kind of monitor prevention efforts are reporting pretty dismal numbers. And this may be why we're having so many cases of COVID now. The Dr. Cohen, Mandy Cohen, the director of the CDC, is urging the public to get COVID and flu vaccinations, but only 40% of adults, it's actually about 46%, plan on getting the new COVID vaccine. 47% received the flu vaccine last season, and more of those in the people over 65 who are truly at risk. And the projection for the RSV vaccine in adults, it's only approved for people over 60, about 40%. So, we have less than half the population really jumping on these vaccines. And it's very unfortunate. And if you take pregnant women, we know that if they take the COVID vaccine while they're pregnant, they benefit the mother from getting COVID when she's about ready to deliver, but they also pass on the antibodies to the child. So the child is protected too. So this is, just another thing that can happen. It's very safe in pregnancies. And the bottom line here is that across all vaccines now, the lack of trust really ranks very high. 31% is a reason for not getting these shots. And hopefully we can overcome some of that lack of trust, especially with the experience that has happened over the last couple of years. I mean, somewhere between 12 and 18 billion doses of the COVID vaccine have been given. And, if there was any like major problem, we would have known by now. And keep in mind, vaccines in general have saved more lives than any other medical intervention in the history of the world. COVID-19 is still a serious disease and the fourth leading cause of death in the United States. And this came out of nowhere. In other words, this was added on top of all the other reasons why people die. And respiratory syncytial virus is the RSV virus is one of the leading causes of hospitalizations in kids. Now, kids have this monoclonal antibody they can take. But there are ways to prevent these things, and people really need to be careful, especially if they have any kind of underlying disease. But the point is, flu and COVID is recommended for everybody 6 months of age and older. Taking care of yourself, of course, is the most helpful thing. But if half the population doesn't take it, you're still spreading tons of virus around. So, we need to get those numbers up if we really want to get this thing under control. And we just have to try to communicate better.
Absolutely. And staying on the topic of vaccines, our first submitted question this week comes from a viewer who is 65 and has certain underlying conditions that were aggravated by the mRNA Pfizer or Moderna boosters when they initially got those. They know that the new Novavax vaccine uses different technology. They were wondering if they should go for that vaccine first and foremost, and what the recommendation is for the Novavax vaccine. If you have already been vaccinated, do you just need one shot of the new vaccine, or do you have to go through the whole cycle again?
This is really a great question because you really do have an option on what kind of vaccine that you take. Pfizer and Moderna are this mRNA technology. The inventors of it, by the way, just got the Nobel Prize, so somebody believes in them somewhere. The advantage of the mRNA vaccines is you can make them very quickly. Look, we had discovered COVID December 31st, 2019. It was sequenced by genetic sequence by mid-January, and there was a vaccine available on the market in December. That is just unbelievable. That couldn't have been with the regular type of manufacturing that goes on for vaccines. The mRNA vaccine is just very simple to do it. It's not simple, but once you get the codes and everything, it's easy to ramp up, test, and whatever. So now back to this person here, 65, high risk, has tinnitus that's ringing in the ear, and which was aggravated by her vaccines, and she took the Pfizer and or Moderna. It must have gone away because she doesn't say that. I mean, it went down to its baseline. This is a side effect of a kind of any vaccine, but okay. Would it be a good idea to get the new Novavax vaccine? I think, yeah. I think this person should try the Novavax vaccine. Maybe it's got a different side effect profile. It works just as good. It's the older technology, protein-based vaccine. And her other part of the question is also a great question. She said, do I have to get the 2 shots and all that stuff? No. You look at the Novavax vaccine as just another COVID vaccine. You don't have to start with a 2 and then get boosters. Just get it. And that's all you need to do. And she should try it, and she should let us know if she has less side effects. I would be really interested in hearing from this person again. So the Novavax vaccine was approved, I think 2 days ago, 3 days ago, and it's out there now, just like any other one. And go ahead and get it. It works just as good. There's no question about it that it works just as good. It's a different technology. It's very similar to all the other vaccines that you've ever taken in your life. So, go for it. It's fine. Getting the vaccine is the most important thing. Nobody cares which one you take. Just get it. And it is geared toward, just like the mRNA vaccine, just like Pfizer and Moderna, it's geared for the circulating viruses right now. So it's fine. So this person only needs one shot. I would do the same thing that this person is thinking, and just go get one shot of the Novavax vaccine.
Absolutely. And following up on that, we were talking about the spacing out of and the intervals between vaccines, and that you don't need to, redo your cycle.
Yeah, you don't have
However,
to read.
for, 6 months from now, when we would potentially or be looking at some sort of another vaccine or a booster of the current vaccine, do you think that in 6 months' time, people will, think about getting that booster, or has there been other recommendations? Have we not seen that?
Yeah. So what they're trying to do now is simplify the guidelines, because one of the big criticisms and why people are reluctant to take these vaccines is we made everything. I don't know if you remember those algorithms. They were confusing. I mean, I had trouble interpreting the algorithms because, it's like this age group versus that, and like this, if you had one shot or two shots, I was like, oh, forget it. So now they're just saying, take this. So the current ones that are out now, so Novavax, Pfizer, Moderna, are actually a new vaccine. It's completely different from the other ones that they had taken in the past by the same companies. So they're in the recommendation here, because they don't really know yet, because they got to see how good it works. They know it produces these antibody levels that are out of this world. So, they should work, just like the flu vaccine. We do the same thing every year. But so you may get a booster of this current version of the vaccine sometime 6 months out. That kind of depends. So just wait and see. Start with getting this new vaccine now from any one of those three companies and see what happens. The Novavax vaccine is approved for individuals 12 and older. The other ones are 6 months and older, the Pfizer and Moderna. So it's out there now. Just get one, and because there's just so much COVID out there, and people
Absolutely.
getting hospitalized.
Yeah, better to be safe than sorry in that situation. And thank you so much to our viewers for submitting those questions. We really
That's a
appreciate
really
it.
good
And
question. Mhm.
absolutely. And that will take us to our headlines today. Still on the COVID front right now, there was very interesting research published about links between SARS-CoV-2 and the actual effects that happen with cardiovascular events. There were a lot of big words in there. Could you please explain that to us?
Yeah. So it was known from the beginning that people with underlying cardiovascular disease did worse with COVID. They tended to get hospitalized more. They tended to die more. They had a higher risk of dying from COVID. So what this report is, it's a study on the mechanism of why that would happen. So these scientists found that the COVID itself, we're not talking about the vaccine, we're talking about COVID. Actually, the virus creates this very inflammatory environment that makes it easier for the plaques to grow, the clogging up of your blood vessels around your heart and stuff, easier for them to grow and rupture and block the flow. And so that's why you have a heart attack or a stroke. And it was found that COVID really targets this plaque, the cells, the macrophage, this blood cells in the plaque. And that it tends to go towards the arteries, which are the ones supplying the blood. So this is just some evidence that COVID itself can attack people who already have plaque in their heart. And it explains why, or it's a possible explanation of why people with underlying heart disease do so much worse with COVID, and why it's just best they don't get bad COVID, So, I mean, it just makes a lot of sense. So it's nice to see some science supporting what we already knew was high risk. And now it kind of all makes physiologic sense. So if you've got pre-existing heart disease, I think this is one of the possible explanations as to why outcomes are so bad.
Yeah, and thank you for going through and explaining that. We've received a lot of questions in the past or just seen a lot of interest in, these trends of why certain people with underlying conditions seem to be affected worse, more severely by COVID. So it's really nice to start seeing some of those biological and mechanistic, reports coming out to help answer these questions.
Right. So if you have any underlying heart disease, this is just yet another big reason to try to prevent you from getting super sick with COVID.
Mm-hmm. And switching gears a little bit, the United States has had year after year very, very high rates of STDs and STIs. There was a big announcement this week where US health officials are proposing to use an already on the market antibiotic to fight against these STDs and the spread. Can you break that down for us?
Yeah, well, there's been an increasing record high sexually transmitted infection rates in the United States and around the world. And they're trying to figure out how they can deal with this a little bit better. And there are proposed guidelines. So this is just a proposal. The Centers for Disease Control on Monday proposed to use doxycycline, which is a tetracycline type drug, old drug, generic, been around forever. It's a very common antibiotic, and there were 4 big studies that were, and one of them was even published in the New England Journal of Medicine, which is like the top journal in the United States, that found in groups of high-risk people, which were predominantly men who have sex with men, showed that if they took 200 milligrams of doxycycline within 3 days of being potentially exposed to an infection, they were 90% less likely to get chlamydia, 80% less likely to get syphilis, and 50% less likely to get gonorrhea compared to those who didn't take the pill after getting sex. Now, so that's a major public health reduction. Now, of course, we have to consider, and the reason why these are just proposed guidelines right now is because there's a lot of comments about, if we start doing this, are we going to get a lot of resistance to the doxycycline? And that's the big thing. In these big 4 studies, they didn't see it. But in the 1970s, they did it with another tetracycline drug, minocycline, and they had tons of resistance and it was abandoned. But doxycycline is a different drug. Maybe it'll hold up better. But anyway, this will be down. There's so many sexually transmitted infections now that they're almost running out of the drug, which is an injection of penicillin to treat syphilis. So it's just another way to combat yet another little epidemic that's going on around the world right now.
Yeah, and those are very strong numbers coming out of those studies. I believe it's a 45-day waiting period before those proposed guidelines may go into place or are approved. So we will keep you all up to date on that if we get any more news in that time. But moving on, there was another announcement from the WHO, which recommended a malaria vaccine to be rolled out next year. Can you tell us a little bit about that vaccine?
So malaria, it's still around after all these years. It kills 600,000 people per year, mostly kids under 5, and people at risk, including pregnant women. Can kill anybody. If you've never been exposed to malaria, say you're a traveler and you get malaria for the first time, it can kill you. There's deaths every year in places where there's malaria, and people go and they don't take the prophylaxis to prevent malaria, which is taking pills. Now, people in those areas, sub-Saharan Africa and places in Asia and stuff, they've had malaria many times in their life. They have some immunity against it. That's why the only ones that are ambulances going by, sorry about that. The only reason that the kids are most prone to get very severe disease and to die from malaria. So a vaccine was produced by Glaxo, and that was released actually over a year ago, I think, 2 years ago, 2021. It's only 30% effective, okay? But still, from a public health perspective, it's about a third. So, you've got 600,000 people dying for years. So everybody took the vaccine, you'd save 200,000 lives. So that's where 30% comes in. There's other ways to prevent malaria. You could have mosquito bed nets, you just get rid of the mosquitoes, bring in, genetically modified mosquitoes that can't reproduce. I mean, there's all sorts of other things going on about malaria. But anyway, the vaccine is one of them. And we know that vaccines are the most effective intervention for many of these diseases. Now, so the new vaccine is developed by, and so anyway, Glaxo makes about 15 million doses a year. Like there's billions of people that are exposed, that are at risk for this. So they don't make that much. Now, Oxford University in United Kingdom and Britain, with the help of the Serum Institute from India, who's a big manufacturer of vaccine products, by the middle of 2024, are going to be making millions of doses, maybe 200 million doses of their vaccine, which will cost $2 to $4 a piece. So it's going to have a huge public health impact because you'll have the supply and the cost reduced. So that's the big deal with the malaria vaccines right now. So it's probably not any more effective than the GSK vaccine, but it's just going to be easier and cheaper to get out to more people. In a separate decision, the WHO expert group also authorized a dengue vaccine. Now, you may or may not have heard of dengue. This vaccine is manufactured by Takeda. It was also approved by the European Union, and it's kids are at most risk for severe dengue. So it's approved for children 6 to 16 who are at high risk for getting the disease, and it's about 84% effective in preventing hospitalizations and 61% effective in stopping symptoms, which often get mixed up with malaria because the same kind of symptom. Because there is no treatment for dengue, there is treatment for malaria. So, right now, in a lot of places with, they don't have the appropriate laboratory facilities and stuff, if somebody comes in with a fever, they look really sick, they get treated for malaria. So a lot of them are probably getting treatment that doesn't do anything because dengue doesn't respond to that kind of treatment. So, for instance, in Bangladesh, which was the country hardest hit by this year's dengue epidemic, nearly 1,000 people have died. And in the world, there have been over 2,000 dengue-related deaths this year and over 3.7 million cases. So the death rate is not that high percentage-wise, but when you look at the numbers, you're talking about thousands of people. So this will be another big advance.
Absolutely. And these are very big steps that could save a lot of lives. So it's really great to see. And speaking of other very great, large steps to help save lives, the country of Pakistan has announced and launched an anti-polio drive to vaccinate children. Can you tell us a little bit about that?
Well, polio is a potentially eradicable disease. So it was almost eradicated, several times. And the Rotary Foundation and the Gates Foundation have really pushed hard, but there's always a couple places in the world where it's just, they're not taking the vaccine and they can't seem to get rid of it. So Pakistan in particular was close to eradicating the disease in 2021 when there was only one case reported, but that's popped up. There's now a dozen cases, and they've got more, and so they're putting this one, just hopefully last push a nationwide anti-polio campaign to inoculate 44 million children under the age of 5, which involves 350,000 healthcare workers in the capital city of Islamabad alone, to go door to door and administer these vaccine drops to finally get rid of it. It's potentially an eradicable disease. So, and, you know, polio is a horrible disease. And, you know, it's almost gone, but not quite. And so until the last case is snuffed out, it's always going to be a problem. So this is, it's good for Pakistan. And there have been, of course, you know, anti-vaccine groups in these countries that are still having cases. And I mean, actually, healthcare workers have been threatened. Some of them have actually been killed. I mean, it just is just a very crazy situation because it's so close to being eradicated. So just we need to support them to get rid of this. Otherwise, it will never go away.
Absolutely. And it may be a little bit of a shock hearing inoculating 44 million children when there was just, you know, 1 to a dozen cases. But like you said, if there's one case, it's not gone. So totally worth it and worth our
Like a
support.
fire, you got to put it out until the last spark is extinguished. Otherwise, it just comes back. Highly contagious disease, awful consequences.
Absolutely. And on that note, I'd like to thank you, Dr. Murphy, for your time and expertise in answering our viewer submitted questions, reacting to the COVID statistics, and also breaking down these headlines for us. So thank you very much.
Well, great. Thank you, Katie.
And thank you everyone for watching again this week. We again ask for any questions to be submitted down below via email, via our Facebook page, or anywhere you can connect with us. Thank you, and we'll see you next week.